From WRAL News and the Capital Broadcasting Podcast Network, this is your coronavirus news brief for Monday. I'm Mark Boyle. Here's the latest on the metrics and trends in our state from the WRAL data trackers.
I'm Ashley Talley with WRAL's Data Tracker team. Our big headline right now is how close we are to our January peak in several categories, including cases and really especially in hospitalizations. 8,590 new COVID cases were added Friday. We had a little bit more than that last Thursday, but before that, this is the most cases that have been added in one day since January 15th. And DHHS put out a note that seems to indicate it actually could be even higher. They put results from some labs were not received due to a technical issue with reporting from the National Electronic Laboratory Reporting Platform. This issue has been resolved, and these results will be included in the next dashboard update on Tuesday, September 7th. So that makes it seem like that number could be even higher than 8,500, which is disturbing. We've also seen our deaths going up. Just today, there were 83 new deaths reported. Remember that the number of deaths we talk about each day is not the number of people who died the day before. It's the number of people who were confirmed to have died from COVID. That could be last week, that could be last month, that could be last year. It depends on when the coroner or death certificate lists the cause of death and how that information gets collated into the state's databases. So with 83 new deaths reported today, we're up to an average of 56 deaths in North Carolina being reported every single day. That's pretty high. That's the highest we've seen since February 24th, and it's made our average go up 6 just from yesterday. If you look at the average number of deaths over time, it's doubled just in the past 2 weeks. And hospitalizations, of course, is one thing we've really been watching. Today, we're up to an even 3,800. That's the most since January 18th. Like I said, we're getting really close to those peak numbers, especially when it comes to hospitalizations. Our peak, the most at all time that we've had throughout this pandemic, was 3,992. We're just 5% lower than that today. Of all those people, about 25% of them, 930 people, are in ICUs with COVID, and 646 of them are on ventilators. That's about 17% of all people hospitalized with COVID. If you look at all the hospital beds in the state, 80% are full. So that means about 20% are open. And if you look at ICUs, that number goes up to 89% being filled and about 11% being available. I want to put that in context, though, of when you look at everybody hospitalized in the whole state. I think we think of hospitals right now being only people with COVID, but that's not true. It's about 23% of everybody hospitalized having COVID and 31% of everybody in ICUs. Our positivity rate is down a little bit to 11.7. It's been up in the 13, 14, and even 15% range over the past couple days and weeks. But our vaccination rate remains steady. Just this week, we did go up in the percentage of both adults that are fully vaccinated and partially vaccinated. So 61% of all people 18 and older in North Carolina are fully vaccinated. 66% of all adults have at least one dose. That sounds really good. So we looked at how North Carolina ranks when it comes to other states, and it turned out 61% isn't that great. We rank 36th in the country when it comes to percentage of adults that are fully vaccinated. Up at the top are some of the New England states, like you might imagine. Actually, Hawaii right now is the number one most vaccinated state with about 88% of all of its residents being vaccinated. And beneath that are Vermont and Massachusetts with about 87%. Down at the bottom, we have some states that are out west and some that are in the south. West Virginia and Wyoming are kind of tied down there at the bottom at around 56%. So you can see North Carolina still has a way to go. That's your COVID data update.
WRAL's Debra Morgan spoke with Donald Hughes, a community advocate and volunteer who runs a mobile vaccine clinic in Durham, about vaccine hesitancy and the reason he hears for people's reluctance.
Donald, you also had the chance to meet the president when he was here over the summer. Thank you so much for taking the time to speak with us tonight. What is the biggest concern you hear from community members about the vaccine?
Well, thank you, Debra, for having me. I'm excited to be able to chat with you about some of the concerns and hesitancies that we've been hearing in the community as we work to get folks vaccinated. One of the biggest concerns that we've heard in recent weeks is, well, if I get vaccinated and I'm still able to get coronavirus or COVID-19, then why should I get vaccinated? And the response to that is very simple. What we've seen since the start of the year is about 7,200 individuals have died in the state of North Carolina due to coronavirus. And of those 7,200, about 150 were vaccinated. So if you take that ratio, we're talking about 98% of the deaths since the start of the year have been from individuals that were not vaccinated. So the data is clear. The vaccines work, they're safe, they're effective, and they can help prevent folks from getting severely ill or hospitalized, or even in many cases, contracting COVID-19.
You have a mobile unit so you can go around and deliver the vaccinations to the people where they live. When you approach them, do they tell you, oh, I've been meaning to get my vaccine and thank you so much for being here, or do they still refuse the vaccine when you show up?
Well, it's a mixed bag, but we hear a lot of folks who are just grateful that we're bringing the vaccinations directly to their communities, directly to their doorsteps. One of the things that we know is that transportation and access to the vaccine is still a problem across the state. When we think about our rural communities, when we think about some of our urban areas that may not have as good of access to public transportation, we know that we have to get the vaccines directly into our communities. And when we're there, the community overwhelmingly is grateful to see us and to have the vaccines right at their doorsteps.
You know, it sort of felt we were kind of getting to the point where everyone who wanted a vaccine had already gotten it. And then tonight, one of the doctors answering the phones in our hotline said that they were able to convince 3 people to get the vaccine. They just wanted that reassurance. So do you think we've hit a cap on the number of people who want the vaccine, or will there be more people who just need that reassurance and will get it?
Well, it's absolutely getting harder and harder to get folks vaccinated. We know at the start of the pandemic or the start of the year when the vaccines became available, those that really wanted it did everything they could to get the vaccinations. And now we're at a point what we like to call the last mile, where we have to work even harder to make sure that we're increasing access and availability of the vaccinations. And one of the things that we do at all of our vaccination clinics is ensure that we have doctors on hand that look like the communities that we're serving. So individuals from Black and Brown communities are able to talk to Black and Brown doctors to have questions answered about coronavirus, about the vaccines, or any other healthcare concerns that they have. And when we build that trust and when they're able to see a medical professional that looks like them, we've seen at a number of our clinics, we still have been able to convince folks that are on the fence to get vaccinated. So we're not going to stop until we reach every North Carolinian that wants to get vaccinated, and even some of those that don't know that they want to get vaccinated at this time.
That's awesome work that you're doing. Donald Hughes, working so hard to make sure our communities have access to these vaccinations. Thanks so much for your time tonight and all the work that you do.
Thank you, Debra.
For the Coronavirus News Brief, I'm Mark Boyle.